The repair focuses on closure of the cleft defect or palate to restore normal function. Your infant will usually have the cleft in the lip closed at 3 months of age and the cleft in the palate closed at 6 and 9 months of age. The anatomy includes the philtrum and cupid's bow, nostril and nasal floor, gums, the hard palate, soft palate, vasculature, nerve supplies, mandible, maxilla, teeth, and the midface bones. The hard palate is a palatine process of the maxilla, the incisive foramen, and the greater and lesser palatine foramen. The soft palate consists of two parts, the anterior and the posterior portion. Vasculature is the greater palatine, lesser palatine, and the ascending palatine artery. The nerve supply consists of a greater palatine nerve supply and a nasopalatine nerve supply. The mandible is referred to as the lower jaw, and the maxilla is the upper jaw. The midface bones consist of the nasal bones, the acromial bone, ethmoid, sphenoid, maxilla, zygomatic bone, and the palatine bone. The lip forms between the 4th and 7th week of pregnancy. During the pregnancy, body tissue and cells from each side of the head grow toward the center of the face and join together, making the face. A cleft lip happens if the tissue that makes up the lip does not completely join before birth. This results in the opening of the lip. A cleft lip can be on one or both sides of the lip or in the middle of the lip. The roof of the mouth, which is called the palate, is formed between the 6th and 9th weeks of pregnancy. A cleft palate happens if the tissue that makes up the roof of the mouth does not completely join together during the pregnancy. For some, both the front and back parts of the palate are open. For others, only part of the palate is open. Congenital, a defective growth of the palatine shelves, a failure of the shelves to attain a horizontal position, lack of contact between the shelves, or a rupture after fusion of the shelves. In most cases, a prenatal ultrasound can detect the cleft lip and the cleft palate as early as 16 weeks into a pregnancy. The diagnosis is then confirmed at birth with a detailed visual assessment and a physical examination. Very rarely, a baby may have a mild instance with the cleft palate, which involves only the soft palate. This type of cleft may not show up on an ultrasound and may not be noticeable until the infant experiences difficulty feeding. At that point, the clinician will perform a comprehensive exam to identify the exact nature of the problem. Keep in mind that someone does not have to have both the cleft palate and the cleft lip. The patient can have either or. The patient is administered general anesthesia. They are then positioned in supine and prepped. They will also be draped for a head and neck procedure. An incision is made along the vermilion border towards the cleft side, and the mucosa is separated off the oris muscle. The medial lip is detached from the maxilla. A Z-plasty incision is made through the skin, muscle, and mucosa. Flaps are created and the wound is closed with interrupted absorbable sutures. For the cleft palate, the patient is placed in supine with a head hyperextended. A mouth gag may be inserted, and the surgeon may also use local with epi. An incision is made along the borders of the mucosa and extended through the mucosa muscle and the nasal mucosa. The nasal mucosa is elevated off the palate and the oral mucosa is separated. Once the mucosa is elevated, an incision is closed with a foroabsorbable suture. The wound is then irrigated and the mouth gag will be removed.